Illness causes rashes on children. It's the latest new development in the coronavirus pandemic, and health officials are sending out a warning. Our Dane Hawkins went to work for you looking into the illness that has doctors and parents on alert.
Mom Sherilyn Miles always has her hands full, keeping up with 5-year-old Logan and 1-year-old Levi.
They're two totally different kids. With Logan, she's more quiet. And with Levi, he is Mr. Man. Like, he's everywhere. He likes to climb on everything. It's always something. Like, you always have to be doing something.
Lately, topping her list of things to keep up with is COVID-19.
With having two little ones, I just have to do everything necessary to keep them as safe as possible so that they aren't catching the virus or catching anything else.
And now health officials are warning parents like Sherilyn about something else.
Pediatric multisystem inflammatory syndrome. We just know that they oftentimes will have many organs that are involved. They'll have fevers, they can have rashes, and then they can have kind of their inflammatory markers in their blood.
It's similar to Kawasaki disease or toxic shock syndrome, but there is one big difference with this illness being seen in kids.
It does seem like, although this data is very, very new, that it could be associated with COVID-19. Many of these patients have had either a PCR positive for COVID-19 or they've had antibodies for COVID-19.
Only leading to further concern for parents.
It's a little nerve-wracking to think that not only could they catch the corona or the flu, but now this new whatever it is.
The condition is rare. Right now, most of the reported cases, about 100, are in New York. And although no cases have been found in our area, the Tulsa Health Department says they're watching the situation closely.
To utilize syndromic surveillance so that we have a pulse on any health concerns that are occurring within our hospital system. So I know that our epidemiologists are closely monitoring any new developments as it relates to COVID-19.
We're getting updates day by day, even sometimes hour by hour, from our national health authorities. And then, like I said, our international partners.
Health officials and doctors alike say there are things that parents can do to keep their kids safer.
So really, if we're trying to prevent this syndrome, it's to really go back and try to prevent COVID-19 in children.
By keeping up with preventative hygiene.
Social distancing, wearing a mask to prevent the spread of respiratory droplets, and washing your hands.
Until a cause and a cure are found.
The main thing that we need to say to people, to parents, is not to worry. Try to be as proactive as possible, though.
Dane Hawkins, 2 Works for You.
Now, the CDC is expected to release some new information and health guidelines regarding PMIS later this week. We'll have the latest for you on air, in our app, and of course on our website, KJRH.com.